Well, we begin with the Ebola outbreak in Uganda. It's been 1 week since authorities declared an outbreak and cases are on the rise. The latest figures from the Ministry of Health show 24 confirmed cases and 5 confirmed deaths. The outbreak started in a small village in the central Mubende district and has since spread to 4 surrounding districts. No cases have been reported in the capital, Kampala. Health authorities are mobilizing health workers to support response teams in the affected areas. Well, for more on the situation, we're now joined by Irene Nakasiita, spokesperson for the Uganda Red Cross. Hi there, Irene. Thank you so much for joining us on Africa Live. Irene, from the information you've been receiving, what's the latest on the Ebola situation in the Mubende district and surrounding areas in Uganda?
Thank you for having me, and good evening to all the viewers. For Uganda, first of all, this is not the first of the kind that we are experiencing. We've experienced Ebola before, but our biggest emphasis has been around engaging communities, because we believe that epidemics and pandemics begin and end in communities. For starters, Mubende and surrounding districts, of course, there is some sense of tension, considering that the situation got people unawares. And what I can confirm is apparently we have 35 active cases on admission and 23 deaths. Now, out of these 23, 5 were confirmed through laboratory tests by the Ministry of Health and other testing authorities, and 18 were probable because at the time they died, they were not tested. Now, what does that mean for the neighboring districts and those and Mubende itself? The Uganda Red Cross, of course, as usual, plays an auxiliary role to the government of Uganda. And our role here is to support the sensitization of communities and preparedness, because if communities do not know what to do, then they can easily spread the disease. And if they are not educated, still it remains a challenge. So right now we are intensifying community sensitization, community engagement, and community surveillance, so that in case there are any cases in the community, people can report, and our ambulances are able, and the teams are able to pick them up and refer them to the Ebola treatment units immediately.
Irene, we've also heard of reports of this disease spreading because some patients have been running away from isolation centers. Tell us more about this and what is being done about it.
Yeah, so from the coordination meeting and engagement with the authorities, it was resolved that one, I think there has to be security deployed at the Ebola treatment unit so that it supports the referral centers. But also one person was traced from those who had escaped, and of course the person tested positive. But that doesn't mean that our efforts are going down on community engagement. They are being traced. We are using the local authorities, especially the local council ones, and then the village health teams, whom we call the VHTs locally, and they're supporting in that contact tracing of this and also tracing of these very people, so that they are able to come back to the treatment center. But in the event that they fail, of course, in case they get them, they'll have to be brought back. If they don't, of course, authorities have to continue with the tracing of the same cases and their relatives.
Irene, how are the affected communities dealing with reports of Ebola spreading where they are, and what measures are there in place to support these communities? You had spoken about measures, but just details of exactly some of the measures that are taking place there.
Well, like I said, I wouldn't really want to be more of an alarmist. Yes, the situation caught people really unaware, but we are calming the situation, I must say, because the authorities are involved right from the district level to the local councils. So we have segmented leadership and involving their communities directly. We have materials that we are using to educate and sensitize people. Yes, people fear the disease, true, but we've guided them especially on reporting, so that in case they see anyone with any symptoms and signs, they're able to report. We have community-based Red Cross volunteers and the village health teams who are working in a coordinated manner under the guidance and leadership of the Ministry of Health and the district health teams. So we are working together to contain the situation, and we've guided the local people to be calm. We have also put up, we know that there are normally rumors, so we are doing the rumor tracking as well, so that we demystify a few rumors that might be going around the communities and keeping people calm so that we manage this together. And like I said, Uganda has never had Ebola. I remember when we had Ebola with the neighboring DRC. This is how we managed it. And so we are employing the same measures to ensure that communities, first of all, are calm, but also working together so that we get the contacts of the people that are suspected. Those with signs and symptoms can report them. And then we have put ambulances in place. So in case anyone is identified, we pick them quickly and evacuate them to the Ebola treatment centers. And we are so sure if we work very well with the communities, like I said, the disease begins and ends in the community. If we work very well with the community, we will curb it.
Irene, thank you so much for all that. Irene Nakasiita, spokesperson for the Uganda Red Cross.